Back live with you tonight on In Focus, and thanks for staying on. Limpopo Health MEC Dr Phophi Ramathuba calls on citizens and holidaymakers to be cautious as malaria cases rise over the summer rainy season. Some parts of the province, particularly the Vhembe and the Mopani districts, as well as the Kruger National Park, are classified as malaria transmission areas. For more on this, we are now joined by the MEC to shed more on this. MEC, good evening, and thank you very much for your time and coming through tonight on In Focus. Global health concern is malaria, of course, endemic in areas like Limpopo as well as in some parts of Mpumalanga and KwaZulu-Natal. Talk to me about two things, of course, that determine the success of our intervention. One is the level of community knowledge about the existence of malaria, but two, the attitudes and practices towards malaria that are practiced in our communities.
Evening to all your viewers out there. As a province, what we can indicate, if you look at since we started our indoor residual spraying program, which also incapacitated within it, we had to bring in seasonal sprayers who are appointed from the same communities that they reside in. For instance, end of August, we appointed 440 that started with the spraying. So that helped us in terms of communities understanding, because it's their own people that they reside with that will go around spraying in this household, compared to differently when we will bring people to come and do the spray. So there was a lot of resistance in the past. So since we started this program, we have seen on an annual basis, we are finding the reduction of new malaria cases, and we are also receiving the reduction in terms of the death cases. If you look at when we started with this program, our cases were more than 18,000 per annum. When you look at where we are now, since this malaria season started, we're at 450, and we've already only experienced 7 deaths, coming from 160 deaths per annum. So you can see the program is working. So it answers your question that community information and community involvement in terms of dealing with any infectious disease, it's very powerful, and even public health emphasizes the fact that do not come in and want to impose your systems on the community without them being part of the solutions to their problem. The only challenge that we've seen, that's why now we are making a call and a warning. If you go to places like the low-lying area of maybe the northern part and the eastern part of the Vhembe region, from the Musina, Madimbo area to parts of Thulamela, or you then move to Mopani, where you look up at the eastern part of your Giyani part up to Phalaborwa and Kruger National Park. Those areas, people who reside in that area, all of them knows the symptoms of malaria. So immediately when they start to pick up, whether it's fever, it's headache, they're able to run to the nearest clinic. And also the nurses at our clinics, all of them are well equipped, and they do understand that any patient with fever and headache at this period, you must exclude malaria. We've also again trained our environmental health practitioner, and they have been certificated by the Health Professional Council to can do testing and introduce the treatment, even at some border posts and working with our port health. Yeah. So those areas, you don't find high mortality rate. Where you find high mortality rate, it will be a person who visited the malaria endemic area without knowledge that this area it has got malaria and not having taken prophylaxis. When you go back home in Gauteng, when you go to visit your doctor, and because malaria presents like meningitis and any other, you don't disclose that I'm coming from Kruger National Park, or even the clinicians in that part of the county are not used to treating malaria. So it's not seen as a first diagnosis that we must work on. You will be doing the doctor will do lumbar puncture and all investigations, while malaria is progressing. And late intervention, malaria, you will find that the person develop cerebral malaria, and unfortunately, that's where the mortality rate gets high. So the message that we want to tell people is that if you know you want to come and visit Limpopo, these are the areas that you must make sure you get malaria prophylaxis.
Yeah.
And these are the areas that when you go back home, should you experience something like these symptoms, you rush to your nearest doctor and tell them, you are not teaching them medicine, but you're just telling them, I am from a malaria endemic area. I am worried that these symptoms might be suggestive of malaria.
Yeah.
Early treatment, which is oral treatment, will simple cure malaria. And that's why we want to run this campaign so that we can help saving our people.
Yeah. Except for, of course, this conversation that we are having here tonight and you sharing this rather crucial information, what are other prominent sources of malaria information, particularly for those who are not from the Limpopo area, who would be traveling there to know which areas would be more prone to have malaria?
I think if people can go to WHO website, they will find such information. If you go to the National Department of Health, if we go to the National Institute of Communicable Disease, the NICD, and there are many other sources, they will be able to show you that this particular area has got, it has been declared as a malaria endemic. You know, what is important is that try to do some research before you travel to provinces that you have already spoken about your part of Mpumalanga, part of KZN and Limpopo, and also within our SADC countries. If you're going to Mozambique, please try to make sure when you're visiting Zimbabwe, when you're visiting SADC country, try to make sure you do your own homework and you get your malaria prophylaxis. And that will be able to help you to say, even if you visit, you will not be infected. Because how do you get infected? It's just the female mosquito, that Anopheles, which feeds on our blood and beats us. It feeds from one blood of an individual and it transmits through its saliva. When you hear it stinging you, you must know that it is transmitting the malaria, because you don't know who did it sting first. And unfortunately, that's how it's being transmitted. There are other mosquitoes. We don't know, we don't understand why is it a female one, but the fact is it is a female one. The others do not necessarily transmit malaria. So that's how you can be able to protect yourself, especially your family, because this is a time where families are traveling together. There are children involved. Yes. We all know that the children's immune system is still weak. So we need to really be vigilant when we are going on holidays with our children.
Right. Except for the positive treatment-seeking behavior, which you mentioned, of the people in Limpopo who are aware, the other question that, of course, comes to mind as you're raising the question of mosquitoes is the availability or even the access to bed nets. Is this an economic issue? Is there an economic barrier there? Because even with those who are aware, the availability of bed nets is still very low.
It is very low, because that is why, as a province, we have opted on a more effective way, the indoor residual spraying. As I've indicated, we start each year, beginning of September, we reinforce our staff and move from one household to another. We also, to an extent, early when we started, I was around the lodges within the Musina area, where we were launching, where we work with tourism industry within the province. They identify lodges who want assistance from us, those that can't afford those nets, or those that don't have them, or even those that do have, so that we go in and do the spraying, so that when we have sprayed, the mosquito cannot stick on the wall. It will definitely die. So that is what is important. But we are also saying there are other ways of protecting yourself. For instance, if you are visiting a lodge, we know that mosquitoes are related to the climate or to the weather. So if you have your aircon, it is very difficult for the mosquito to be able to survive. Some people can use the fan. And we are also saying to the community, some of the information when we're doing community training, it's the issue of saying, please, the hygiene. When you have water, like now we are being blessed with its rainy season. It has been raining in the province of Limpopo. So you'll see that people have got dams all over, buckets are left with water. So we encourage that, let's make sure that that water is not there, because when you leave it there, mosquitoes start brewing there, and that is danger which is coming towards you. We're also encouraging that children must not be playing outside in the dark, because even if we have sprayed inside the randavel or the house, but they are playing outside, they can be beaten outside.
Right.
We're also saying when you sleep, if you can wear those pajamas which will cover what we call cover both your lower and your upper limbs. In that way, the long sleeves one will be able to protect you from bitten by the mosquito.
Right.
Basically, what we are saying is that you need to cover yourself and avoid being bitten by the mosquito.
Right.
If you don't get bitten, you will not get infected.
MEC, appreciate your time, and thanks for the alert and joining us tonight. That's the MEC for Health in Limpopo, Phophi Ramathuba. Still to